This is Better Black Health with Dr. Greg Hall.
Each episode, we're going to basically talk to or get a story behind one of my patients that kind of presented with a health problem. We're going to hear all their complaints, their issues, their life issues, their family history, and then we're going to try to see if we can figure out what the diagnosis is, and then we're going to learn some more about that and related diagnoses. So let's jump right in. This first patient is a 52-year-old black male. He presented to me for a physical because he had not seen a doctor in many years. In fact, that was on purpose. He kind of avoided doctors, right? He was not a fan of doctors, not a fan of hospitals or exam rooms or anything about that. I've seen a number of patients that were that way, just not a fan of doctors. He said they don't really listen to him. They don't listen. They're only in it for themselves. They're shifty. They don't sit down. They rush. It's all the usual complaints about kind of why he wasn't in a big hurry to come and see me or any other doctor for that matter. He was not on any prescription medicines, and he basically said he takes a men's multivitamin. He takes a vitamin D, a vitamin C, and a vitamin E because he said he wants to stay healthy and he considers himself a healthy person. He walks periodically, but he says really most of his exercise is really at work, because he works as security. And so I will say a little bit more about that later. He's never had a colonoscopy, and he's not had any blood drawn to see what's going on in his blood for many years. He complains of being tired a lot. A lot of the time he's just tired. He says there's stresses at home, and he's got stresses at work. He works security at the water department. And so he's got to there's always threats for cyber attacks and real attacks and people trying to contaminate the water. So it can be a big deal if something got in past security. And so because since the pandemic, there have been fewer sort of people who have kind of dropped out of the workforce. And so they're short-staffed at the water department. And so he's been asked to work many more hours than he was used to, sometimes 12-hour shifts, sometimes 6 days a week. And that's added stress because, he doesn't really feel like he has a home life. And then there's not, he's recently divorced, so there's no one else at home. He says he's got grown kids that are always in his pocket, right? So grown kids are always in your pocket, right? There's a big debate over what's worse, having little kids or grown kids who don't, little kids that don't listen to you or grown kids that don't listen to you, right? Which is better, right? He says because he's working these long hours, they're asking him to do these extra shifts. He's eating a lot of fast food, and so he's not really eating. His diet, he said, is not really that good. He's kind of just runs to the closest fast food place he can go and kind of catch a bite, and either he's going home to go to bed or whatever. There's no one really cooking at home, and he can cook. He said he just doesn't have time or the energy at the end of a long day to cook. So he says, I sometimes have chest pain. It sort of comes and goes, but I don't know if it's associated whether if I'm doing something or whether it's just muscle pain. It's not a problem, but I do have it pretty every now and then. And what makes me think about it is it's a family history. His father died of a heart attack at age 62, and his mother had lived longer. She died at age 78, but she had dementia, and maybe had a couple little strokes before she died. They kind of did a test and said she'd had some strokes, but they weren't aware that she had strokes. She also had a brother. He has a brother that had a stroke at 58, but he said, his brother smoked a lot, and so didn't really take care of himself. So he wasn't surprised that he, sort of had a stroke. The patient also reports his sleep is poor. He has trouble going to sleep and staying asleep. And, people have said in the past that he snored, but now he's sleeping alone. So he says he's not sure. But when he wakes up in the morning, he doesn't necessarily feel refreshed. He just sort of gets up and goes, right? From a social standpoint, he's not really dating or anything because he's working all these extra hours. He's a non-smoker. He doesn't smoke, but he says, well, he does sort of smoke marijuana, on occasion, right? So he's not smoking cigarettes, but he is smoking marijuana. And as far as drinking, he says, well, he only drinks beer. He drinks beer sort of in the evenings when he gets home, a long, stressful day. He'll have a beer or two. So that's sort of our history. So let's jump over and talk a little bit about these sequence vitamins. My patients who take vitamins take a multivitamin. They take a vitamin D pill, a vitamin C pill, and since the pandemic, they've been taking a zinc pill on a daily basis. So that's what's that, multivitamin, 1, 2, 3, 4 pills on a daily basis that are vitamins, right? They take the vitamin D because there's not enough vitamin D in their multivitamin that they take. They take the vitamin C because it's they've heard that it helps decrease their heart disease, and they take the zinc because of this pandemic, right? And zinc has been shown to decrease what's called viral replication. It sort of decreases viruses kind of taking hold, right? And if you're actually catching a cold or something and you take some of those zinc tablets that are out there, 3 out of 4 times, you can kind of head off a cold just by taking zinc. Who knew? And that's been proven. Zinc actually helps fight off viruses, and that's what colds are. Flu is a virus. Colds are viruses. So when I was writing my book, I confirmed a number of sort of nutritional differences that were unique to Black people, unique to African Americans. I knew that we tended to have low vitamin D. I had heard that almost regardless of your skin tone. In fact, when I draw vitamin D on my patients, they almost always were low, right? What I didn't know was there are other significant nutritional deficiencies in African Americans that were significantly different from white people or even Hispanic Latinos. We tend to have lower zinc levels, low magnesium levels, and low potassium levels. And there are health consequences related to these low levels. Low magnesium if you have heart issues is a problem. Low potassium if you have heart issues. You go in the hospital with chest pain and they're going to find your potassium's low and they're going to give you some IV potassium. And so that's something that happens every day on a daily basis in emergency rooms. So I designed sequence multivitamins to replace all the vitamins and minerals that are usually low in African Americans. That way, rather than taking 4 multivitamins a day, they can just take 1 sequence multivitamin. So go to sequencevitamin.com and order your bottle of sequence multivitamins. They have one for men, one for women, one for men over 50, and one for women over 50. And you know what? The vitamins for men and women over 50 have more in them than the vitamins for men and women under 50. So, because there's more risk for issues related to heart and cancer and whatnot. So you actually need more intervention, more vitamins than you do less. So now let's talk really before we get back to our guy with the hypertension. One of the things that he mentioned was that he drinks beer. He only drinks beer, and so I've had patients say, I only drink beer. And that's not really alcohol, right? I don't drink alcohol. I only drink beer, right? I've heard that. And so people even brag about, I only drink beer. I don't drink hard alcohol, right? But beer is an alcohol. Beer is 4 to 7% alcohol. So you've heard about proof, right? Proof, what's a proof? 80 proof. This is 40 proof. Proof is basically twice a percent. Vodka, for example, is 40% alcohol. That makes it 80 proof. You just double the percent. 80 proof, 40%, right? So beer is basically, it says 4 to 7. So let's say beer is 7% alcohol. It's 14 proof, okay? but it's alcohol, right? This means it's got 14% alcohol, 7% alcohol. Wine tends to be 12% alcohol, and spirits tend to be 40% alcohol. But alcohol is alcohol. It's a chemical, right? So one can of beer is equal to one of those sort of wine glasses of wine, and it's also equal to a shot of vodka. And so when people with it, I know will usually put 2 shots, one a double, rum and Coke or whatever, and so that's going to be 2 of those. That's sort of equal to two cans, the alcohol in 2 cans of beer, or the wine in 2 wine glasses. And so in terms of so it's still, I've had people come over my house with show up with a 12-pack of beer, and I'm thinking, wow, how nice of them to bring beer, and then watch them drink 6 of them in succession, 6 of them right after the other. And so now they've just had 6 shots of vodka, and they've had 6 glasses of wine, or so it's beer drinkers tend to drink their beer a little faster, or at least the beer drinkers I hang around. So one of the other things that you think about related to alcohol is the the calories. Are there calories in what's a low calorie, and what's a light beer and whatever. So a light beer has about 100 calories in it, whereas a regular beer can have 200 up to 500 calories, believe it or not. And those calories kind of come from how the beer is made, and then. Believe it or not, vodka, tequila, gin, they all have about 100 calories. A shot of that is 100 calories. And so a lot of times when people are drinking, they don't eat, because if they're drinking a lot, they may be, 10 drinks, 10 shots. That's 1,000 calories. They're not healthy calories, but it is 1,000 calories. And there's no added sugar. There's sometimes people who are diabetic will say, I drink a certain type of vodka because it's good for diabetics. I tried to see if that was true. I couldn't find that out. So I don't think one vodka is sort of better than the other. None of them have carbohydrates added to it, starches added to them, or anything. So I don't think it's an issue. And so just to briefly sort of talk about alcohol. When he said he drinks only beer, and he says he drinks a couple. I don't know. He may be drinking a little bit more beer than we think. So now let's talk about a possible diagnosis for someone. I mean, if there is a diagnosis for someone like this, I mean, the things that he could have, obviously at 52, he could have heart disease. He could have a heart problem. He's African Americans are increased risk for heart issues, and so that's always something that we have to sort of keep an eye out for. He could have high cholesterol. He's eating a lot of fast food. So that could give him heart issues. Heartburn, right? If he's eating fast food, greasy food tends to cause more, we call it reflux, right? And so he could be having heartburn that was giving him sort of a chest pain. And I've certainly had chest pain due to heartburn when I had spicy food or had some alcohol at some point. So that's also a concern with this chest pain. He could have a muscle strain, really, if he's just lifting or moving or help someone carries a suitcase or something, and that can cause a muscle strain, and that can give you occasional, sort of chest pain. There's some other things that are not heart disease related. This thing called myocarditis is an inflammation of the heart muscle, or pericarditis, which is an inflammation or irritation of the coating of the heart. That can be something that he has. He could have heart failure. Heart failure is where, the heart has having trouble processing the blood, having trouble pumping the blood through your system. And so that can be a problem. Sometimes that trouble pumping the blood is related to heart valve problems, right? And so if you have a valve problem, that could give you chest pain, that could make you tired, that could explain a lot of the issues that he has. There are also issues with a pulmonary embolism, right? I always think of pulmonary embolism as when a blood clot sort of goes from your legs to your lungs and can cause, issues with breathing. And so I remember, Hoss Cartwright, the guy Dan Blocker on Bonanza, he died of a pulmonary embolism after surgery. And so, it was heartbreaking. Hoss is gone, but that was a pulmonary embolism. So I always think about when you're having surgery or anything, you got to go to the hospital, you're sitting around long trips. If you go on a long trip, you can develop a clot in your leg, and then that can break loose and go to your lungs, and it can kill you. If the clot's big enough, it blocks it so that your lungs can't put oxygen into your blood, and so that's a pulmonary embolism. They'll put you on a blood thinner called Warfarin. So maybe you may have heard that. So people have blood clot issues. That can cause chest pain. You can be at increased, risk for those things. So with his family history of strokes and heart attacks, everything that puts you at increased risk. There's nothing that a family history will put you at an increased risk for something, almost the biggest increased risk, because it's hard to get past genetics. One of the things he might have is sleep apnea. A lot of black patients of mine have sleep apnea. That's where they're snoring when they're sleeping and they stop breathing. And when they stop breathing, their mind sort of wakes them up, and it says, start breathing. And they start breathing again. But that's very stressful. These episodes of stopping breathing is very stressful for the heart. And the heart can cause you to have high blood pressure, can cause you to have a lot of stress. Abnormal heart rhythms will happen because of sleep apnea, and cause you to gain weight, increase weight gain, and then poor concentration and poor energy. And so sleep apnea is something that we sort of want to think about. And one of the things we didn't talk about with our patient was we didn't say what his blood pressure was. And his blood pressure was 160 over 105, which is high. And we didn't talk about his weight. And his weight was 240. And he's about 5'10". So he's overweight. He's a little stocky, security guard type, but he's definitely overweight. And so being overweight and having that high blood pressure on that one visit could be the answer to what the issues actually are. Think about what that diagnosis is. We've got a 52-year-old African American, hasn't seen a doctor in many years, hasn't had his blood drawn, wants to be healthy, takes vitamins, but he's tired, he's stressed, he sometimes has chest pain. His father died of a heart attack, his mother had dementia, his brother had a stroke. He sleeps poorly, he smokes marijuana, and drinks only beer. Let's think about what that possible diagnosis may be. Let's talk for a minute about our 52-year-old African-American male who presented to the office. Let's talk about the fact that he takes a multivitamin, a men's multivitamin, a vitamin D, a vitamin C, a vitamin E, and so probably some other things too. Let's talk about that. So what is he doing that? He says he thinks he's being healthy, but as you may have heard during this episode, some multivitamins and minerals are beneficial. Well, actually all multivitamins are beneficial, but you can have too much of a good thing, right? You could have too much water. If you drank water to excess, that can cause you to have a stroke. It can cause you to have kidney problems. It can cause all kinds of problems. So if too much water can cause all these problems, and we know that too much of vitamins can. We learned in medical school that you can have vitamin C toxicity. You can have vitamin A toxicity, where you actually come in sick from taking too much of a vitamin. And it's also true of minerals. You can have too much minerals in your blood system. right? And so the rationale behind sequence vitamins is that to give you the amount that you need. So African Americans are low in vitamin D, so sequence vitamins for African Americans have a high amount of vitamin D, much higher than are in usual multivitamins that are made for majority populations. Sequence also has added vitamin C because there tends to be more deficiency in vitamin C. But one of the curious things is that this patient was on vitamin E, thinking he was helping himself, thinking he was doing himself good. But recent studies have shown that vitamin E can be associated with increased prostate cancer. So if you have a 52-year-old African-American male, they're at increased risk for prostate cancer. So why would you want to take a vitamin that's going to increase your already high risk further? Vitamin E and the mineral selenium has been attached to increased prostate cancer and increased aggressive prostate cancer. And so it's really important that if you're a population that has a high risk for prostate cancer, which we all do, I have a high risk as well, then we don't really need any vitamin E or selenium. We need the adequate amount, which we get in a reasonable diet, but we don't need a multivitamin that's giving us more. We do not need that. Selenium or vitamin E, so that's been let out. That's been left off of our sequence multivitamin for African Americans. Now, down the road, if we make a multivitamin for Asian Americans, we might put vitamin E in it because they don't have an increased risk for prostate cancer. We do. So for now, he should probably stop taking the vitamin E. Now, his men's multivitamin also probably has vitamin E in it. It also probably has vitamin K in it, which is maybe increasing his risk for blood clotting. So taking just a generic men's multivitamin or even, a men's multivitamin from some of the major name brands, it's not necessarily a good thing. You're better off, if you're African American, taking sequence multivitamins because I thought about African Americans. I thought about the research that's out there. I considered all the dynamics of how many vitamins and how much you need and what you don't need. And so this patient would stop taking that men's multivitamin. He could take vitamin D. He could take vitamin C. If you wanted to take just vitamin D, you would take 2,000 international units, 2,000 IUs of vitamin D. If you want to take vitamin C, you could take 400 milligrams or 500 milligrams of vitamin C. That'd be perfectly fine. You'd not be doing anything. But you would not take vitamin E. You would not take vitamin K. You could take folate, a milligram of folate. You could take vitamin B12, vitamin B6, other vitamins that you could take in usual doses, mainly because there's not a widespread deficiency. But in terms of zinc, there's 20 or 25 milligrams of zinc in a sequence multivitamin. If you look at your major multivitamins, they're not going to have near as much zinc that's in a sequence multivitamin. So thinking about what he could do to better himself, a sequence multivitamin for men over 50, I'm telling you in an unbiased way, that would be a good thing for him because it's going to give him the zinc to help protect him from viruses. It'll help protect from increased prostate cancer, that people with zinc deficiencies tend to have a more aggressive prostate cancer. It'll help with his metabolism, his immune system overall, so that zinc is very helpful. The extra vitamin D, as we've talked about, is going to help if he's got a tendency toward developing diabetes. It's going to help with blood sugar control. If he has a tendency toward hypertension, which his blood pressure was elevated, it's going to help him with that. If he has a tendency toward cancer, with, again, the smoking marijuana gives him some increased risk for cancer, it's going to help with that as well. So he could think about, his sleep apnea is, I believe he has sleep apnea, but we'd have to do a sleep study in order to figure that out. So now a sleep study is where you actually go to a hospital and they hook you up to leads that kind of measure your brain waves, and they hook you up to your chest. It's sort of a thing that measures your breathing, and they listen to your heart. And so they're able to tell your breathing, listen to your lungs, your heart, your brain waves, and really nail down whether you have a sleeping problem or not, right? So they'll be able to tell if you stop breathing. If you do, how long do you stop breathing? How often do you stop breathing? Is it early in the night? Is it later in the night? It's all sorts of information that they'll get, in the number of times, right? So if you've got severe sleep apnea, you might stop breathing over 100 times an hour. Wow, imagine stopping breathing 100 times an hour. So you can't get a restful sleep if you stop breathing that many times. So a sleep study would be able to narrow that down. And if he were to do a sleep study, which this patient actually did, it showed he had severe obstructive sleep apnea. Severe. So severe that he was stopping breathing multiple times, tens of times an hour, almost 100 times an hour, about 80 times, I think I remember it stopped an hour. And he would wake up coughing and gagging that he wasn't remembering. And all that kept him from getting a good night's sleep, right? So there are stages of sleep when you sleep. There's light sleep, there's deep sleep, there's like REM sleep, which is where you're dreaming. And the deep sleep and the REM sleep are what they call restorative sleep. Restorative in that you get a good rest. You feel better. You feel restored at the end of the night's sleep. So when you go to sleep and sleep 8 hours and you wake up and you're exhausted, then you didn't have a restorative sleep. If you go to sleep and sleep 7 hours and you wake up and feel like $1,000,000, you did have a restorative sleep, right? And so that's how people tell. So when you have obstructive sleep apnea, obstructive because your neck, probably usually because people are overweight, they tend to have thick necks. Their tongue tends to go to the back of their throat, and they start to snore, right? And that goes back there to such an extent when they get to such a level of sleep that their tongue falls back there, they cannot keep breathing. And their brain says, wake up and breathe, or you'll die. And your brain's not going to let you die. So it wakes you up, and it wakes you up over and over and over again. So these continuing waking you up in order to breathe does not allow you to get a deep sleep, and it doesn't allow you to get any REM sleep or dreaming sleep. And so many of these people haven't dreamt in years because they're not getting a restful sleep. So the stress of not getting a restful sleep, that can make you crazy. Really, that can add to your stress. That can drive up your blood pressure. That can put an incredible strain on your heart. It can drive you the stress can drive you to put out more hormones that could cause you to get diabetes. It could cause you to eat more and cause you to gain weight. And so poor sleep can be associated with a whole bunch of things that can lead to bad outcomes: obesity, diabetes, hypertension, irregular heart rate. All those things can come from just a lack of getting a good night's sleep. So this sleep apnea, this obstructive sleep apnea that this patient ended up having, really was impacting him to the point where he was tired, he was stressed, he wasn't dealing with the stresses of life at work the way he was supposed to, and he ultimately decided that he was going to get a sleep study, which he did. It confirmed sleep apnea, and the treatment of sleep apnea is a thing called a CPAP machine. It's almost a mask that goes over. It's not almost. It is a mask that goes over your nose, and it actually forces air past your palate and into your lungs, so that when your tongue goes to the back of your throat, it doesn't block off the airway. So when you have that mask on, the air is pushing in. It can allow you to get a deep and restful sleep while really not trying to while your brain is not waking you up over and over again, telling you to wake up and breathe, because the air is passively going into your lungs. You can get a wonderful sleep once you get a little used to the mask. Now, some people have trouble getting used to the mask, right? Because the pressure is like walking in the wind, kind of breathing out when the wind's blowing real hard in your face. But people get used to it very quickly. They love the fact that they're able to get a good night's sleep. And it can be transformative because, you don't need as much, you may not need as much sleep. You get up energetic, you can go work out, you can go do a number of things because you're not exhausted anymore. In addition, when people start wearing their CPAP machine, if they have sleep apnea, they find that their blood pressure goes down, right? And so that having that sleep apnea was a secondary cause of hypertension. Their blood pressure goes down, their heart rate goes down, the irregular heartbeats go away. They're able to exercise, so their weight and calories are able to go down. And so all good things then come from the ability to wear your CPAP machine and to get a good night's sleep, right? How wonderful is a good night's sleep, right? So that he was able to get a CPAP machine. He was able to tolerate it after a couple of weeks of really trying because he wanted his life to be better. And now his blood pressure has come down to a wonderful 130/75. His heart rate has come down. He's energetic. He's much happier at work. He's fulfilled. He's dating again. And they're not complaining about his snoring. And so life is all a wonderful thing. And so being able to treat his hypertension by finding that it was actually caused by obstructive sleep apnea or just sleep apnea was really life-changing for this person. He was able to volunteer more. It really changed his life. And so he also started taking sequenced multivitamins and stopped taking all those other ones. So rather than taking 4 vitamins every day with lunch, he takes 1 sequenced vitamin. He's saving money, in fact, on the cost of those, and is feeling like $1 million. So that's our story for today. Hypertension and obstructive sleep apnea, and a nice 52-year-old African-American male who had his life turned around. He's saving our water and making sure our water is safe. And so it's a wonderful thing. So join me again next week for the next episode, and we'll find out what our secret diagnosis is, and we'll find another opportunity to talk about health and how we can be healthier. For now, I'm Dr. Greg Hall. Take care.